Revision-guided suture-button bone block stabilisation of the shoulder in the presence of significant retained glenoid metalwork. When undertaking a revision bone block procedure, it's important to take into consideration any retained glenoid metalwork, such as broken screw shafts or metal anchors, because it's difficult to extract these without significantly compromising the bone stock. Screws require a 4.5mm drill hole, whilst buttons only a 2.7mm drill hole. The additional advantage of the buttons is they're drilled in using a posterior drill guide, and you can potentially pre-calculate the trajectory of this drill guide to avoid any retained metalwork. To do this, you need to identify the metalwork position on a coronal CT, then calculate a safe drill trajectory, and then with this predetermined jig position, avoid the existing metalwork. So you take the most anterior CT coronal cut. We know the guide has an offset of 5mm. The drill diameter is 2.7mm, so we position the first drill position. You measure 10mm down from that and work out where your second drill hole is going to be. We know the guide is going to be in the middle of that, so that's at 5mm. So we know the position that the guide wants to be in. To work out that, we want to look at the inferior edge of the glenoid and then measure the distance between the two. In this case it's 9mm, so the drill guide needs to be 9mm up from the inferior edge of the glenoid. We look at the sagittal view to look at the trajectory for the drill guide, and in this case it's going to be perpendicular to the longitudinal axis. We found the best way to measure the distance from the bottom of the glenoid to the position where the drill guide goes in is actually to use a spinal needle marked at a predetermined length. In this case it's 11mm. The advantage of the spinal needle is you can position it in parallel to the glenoid, so we can see where the 11mm mark is, and then we use the radio frequency probe to mark the glenoid itself. We can then bring the drill guide in that position and make our drill holes. So between August 2015 and February 2018 we undertook a revision procedure on 10 patients. 6 of them had had an initial failed Bankart and then a failed coracoid transfer with broken screw shafts. 2 had had a failed Bankart and then an Eden-Hibernate that had failed with broken screw shafts, and 2 had had failed multiple Bankarts with retained metalwork and bone voids. There were 10 patients, 2 were female, 8 were male. They're all available for follow-up. Their mean age was 27.3 years. We undertook 5 arthroscopic Eden-Hibernates. 1 patient had an open Eden-Hibernate with a humeral head osteochondral allograft. 2 patients had an arthroscopic coracoid transfer, and 2 patients had an open coracoid transfer. This is an example of a patient with a failed coracoid transfer, so there are broken screw shafts retained in the glenoid, and this is them after their arthro Eden-Hibernate. This is a patient that had attempted Bankart repair with metal screws and then an Eden-Hibernate, and the screws had bent. So this is an arthroscopic coracoid transfer. This is a patient that had an arthro Latarjet. They were epileptic, and so they'd broken the screws and had a very large Hill Sachs. So this was an open revision Eden-Hibernate using an osteochondral allograft, and we actually used the greater tuberosity for the bone graft, the Eden-Hibernate. This is a patient who had multiple Bankart repairs, so they had retained metalwork and large voids. So by using the buttons we were able to get a compression fixation bypassing the void. So the functional scores at follow-up, 9 out of 10 patients were stable. 1 patient was subluxing, but they were happy. So in conclusion, using a guided suture button fixation technique of the bone block during revision stabilisation of the shoulder in the presence of significant retained metalwork provides a satisfactory outcome in terms of shoulder stability and function. If you'd like to know more about this subject or any other shoulder conditions, visit my website cambridgeshoulder.co.uk or my YouTube channel, Cambridge Shoulder.